Hey everyone, it's Helen. Today I'm going to talk very briefly on hysterectomies. The only one I'm going to discuss is the one that I had 10 years ago, and that was the Da Vinci robotic hysterectomy. So if you're not familiar with it, get on there and Google. It's a laparoscopic hysterectomy. I did not have to have the large incision. However, I know for some, the recovery time is much less with the laparoscopic surgery. For me, it still took about 4 to 6 weeks until I really started to feel a little bit better. So everybody heals differently. Don't get it locked in your head that I have to be better in 2 weeks or I have to be better in 3 weeks just because I read something online. That's the one thing I would discourage you from. I know lots of women who have had hysterectomies, whether it be laparoscopic or otherwise, and everybody's body is different. We all heal different. We all need different amounts of pain medication afterwards. We're all able to get back to doing certain things at a different pace. So do not be hard on yourself. Just, the first thing you need to do is just, I guess, probably take a deep breath when your doctor says we probably need to do this, or maybe you went to your doctor and said we need to do this. I was suffering from endometriosis, and it was probably for about at least, 5 or 6 years where my periods had changed. They had gotten really heavy, very, very, very painful, and it got to the point where I was either spotting or bleeding about 3 weeks out of the month. There would maybe be like a 5 to 6, 7 day reprieve where I wasn't having anything. Other than that, I was always spotting, always miserable. I was starting to deal with dizziness, back pains, leg pains. We tried to go on a birth control. For some, that is beneficial. For me, it did not work. I know some people get the ablation, and that has been a life changer. I have a couple girlfriends, instead of doing a full-on hysterectomy that they weren't ready for, they decided to get an ablation, and sometimes that can be a wonderful option for some who are not ready to do that, to do the whole hysterectomy. So you might want to look into that. For me, having the endometriosis though, the only way that you really sort of can get a lot of relief, especially long term, is by removing your ovary or ovaries. And so a lot of the time the doctors are going to suggest that you do a hysterectomy. Now, being 34, I was young. I mean, I know some of you are probably thinking, Helen, that's not young, but I was young. At that point, I knew I was no longer going to get to have any more children, and I was only 34. I was going to be put into surgical menopause. I was just like, menopause, that's for, when you're in your 50s and 60s, and so I was like, what? Kind of trying to even wrap my head around that wasn't really making sense. However, I also knew that I didn't want to live in that pain and discomfort that I was living in for, those several years. And so it did end up being the better option for me. Since they had like some of those laparoscopic versions of surgery, I thought, okay, that might be a good fit for me. I did a little research. I really would encourage you to do research on whatever method that you're going to do, because even though, like I said, that one is supposed to be less invasive, less time out, this and that, which there probably are some truths to that, it's still surgery, and that's not always the case for everyone, because like I was down and out for about that 4 to 6 weeks. I did not bounce back like some people did, so I needed that whole entire time to recover. And that's really what I wanted to talk about, was the recovery period after having a hysterectomy, because nobody really can prepare you for that. You get your soups made up, or you get your magazines, and you get your little like lotions, care packages, but the fact of the matter is it's a real deal surgery with a real deal recovery. And so I just wanted to just kind of share my experience with that, because I didn't really have the knowledge, and so I was just sort of wanting to help whoever is maybe encountering this particular situation as well. And so for me, right when I came out of surgery, I knew I was in pain, even with all the medications that they have you on. Now, granted, you're not in that buckling over pain, but I was in extreme pain, again, having the uterus and the ovaries removed. I knew, like, oh boy, I was swollen, I was bloated. They have to pump you up with a lot of air and gas, though, in order to perform their surgery. So, of course, you're looking like 5 months pregnant at this point. And the funny thing is like probably for about 3 to 4 weeks, I had to wear my husband's underwear. He's a big guy. So he's about 240. He's muscular. He's a big guy. He's a fireman. But so yeah, those came in handy. So I tell you now, you are not going to be able to squeeze into your little tiny top bikini briefs, okay, or whatever they are. I don't even care if they're the granny panties. I have all of the above. You're going to want to get yourself some extra large underwear. So first and foremost, like I said, I showed no shame. Especially when I had to start kind of trying to walk outside and get movement after my surgery and stuff a few days in. It's like those underwear were my best friends. So that's the first thing I like say. Get a couple pairs of underwear that are about 3 sizes up. Because you're going to be swollen, you're going to be sore, and you're not going to care. Nobody's going to care. And so I come out of surgery, and I'm swollen, and I'm sore. The first thing I notice is they have a big patch, so a hormone patch on me. That's what they decided to put on me. Now, some people maybe are not going to be able to do patches, maybe if you are allergic to adhesives or different things like that. So again, you and your doctor will have the best plan that's going to work for you. However, they had decided that they wanted to do a hormone replacement patch on me. And so I come out of surgery, and there it was. It was right there on my stomach, ready to go. And really, you kind of just place it right in this area always. That's what I always do, kind of in like this hip area, the lower hips and stuff. And you have to alternate because you do get a little bit irritated. And so what this particular one that I'm on, it's called Bevel Dot, and I've been on it now since I had my hysterectomy, so almost 10 years. And you change it out twice a week. And I'm on the lowest dose. I think, one of the lowest doses. It's like 0.0375 or whatever. So I've never had to change that, not since day one, not since I came out of surgery, which is really nice because sometimes we do have to adjust. So if that's not enough for you, or depending on what your doctor decides he wants to start you on, your body, you can fluctuate. There's some wiggle room there. They have some that are a little higher, and there might even be one that's maybe one step lower than mine, so I'm not sure. You'll just, again, have to talk to your doctor. But I know that mine's relatively low, and I have not had to switch it. So I was blessed with that. However, rest assured, they do have other, options. And I know, like, some people, as far as hormone replacement as well, if you're one of the people who are not going to be able to do the patch for whatever reason, they have lotions, they have creams, they have other things that, may work just as well for you. However, I've had no problems with my patch. I absolutely love my Bevel Dot. And the thing that I have noticed, though, is I don't do as well with the generic brand, so that's something that you might want to look into as well. I don't feel like, obviously it's a lot less expensive, which I totally understand because the hormone replacement patches are expensive, especially if your insurance doesn't want to cover a lot of it. However, for me, I don't do good with the generic. I do break out in a rash, and I do kind of break out with some little hives. And I can be a little bit sensitive, though, so that's just my body, my skin and stuff. But I tried that for a couple months doing the generic brand because it was like $50 less, probably more. But it wasn't a good fit for my body. I started breaking out the rash, the hives, and I had to go to the point where I was just like, my doctor has to now write on my prescription. She can only do the name brand, prescription Bevel Dot. So it did take, you guys, a couple of years to really start feeling better. So don't be discouraged. There's probably going to be days where you're dealing with night sweats. You're still dealing with maybe some phantom pains. That especially for the first several months, you're probably going to have lots of cramping and pain as your body is healing and it's trying to find its new norm. And I remember even for the first year and going into my appointments, my checkups, and I told the doctor, like, why am I still experiencing so much like pain in here? And he told me, he said, your body is mourning those parts. Like, your body is actually mourning. It's mourning the uterus. It's mourning the ovaries. It misses it. And I'm just like, oh, that actually kind of made me sad to even think about that, because it's a part of your body. So your body's kind of just still wishing it was there. It's still wanting to have that period that it always had. It's still wanting to perform the way it always had. So be prepared for that. You probably will deal with some of that, maybe even for a year, maybe even 2. Like I said, it definitely took 2 years for my body to sort of try to figure things out a little bit. My skin, I broke out. I had lots of acne, lots of, hormonal stuff going on there as the shift was taking place. So my body was trying to figure out what's going on here. And so I did break out lots of those like zits and sores and things like that. So that was one thing that I wasn't really prepared for. Initially, right out of surgery, you're going to want to find a comfortable place to be. I know some people are able to get right back into their bed. However, if you have one of those like higher beds, I can tell you it's going to be really hard, at least for the first week or 2, to get up on that bed, get off that bed, and maneuver. So if you have a comfy, cozy recliner, I would say just be in that. That's what I did for the first probably week and a half. I slept in my recliner. I had my pillows, I had my blankets. That way I could push myself up and then I could lean back, and it was like, I could kind of prop myself where I didn't have to feel like I was climbing into like this large bed and stuff, and because that was not comfortable for me at all. But some people just climb right back into bed. I've talked to women, they're like, nope, I slept in my bed. I'm like, huh. So, but if you have a comfy, cozy recliner, I would highly recommend that. I think that obviously having food prepared, I know that you're not going to want to be in the kitchen, you're not going to want to be cooking, and I know for a fact that we're not supposed to lift anything over, I want to say 10 pounds, and I think that's like at least like 7 to 10 days, if not longer. So you're not going to be wanting to lift anything heavy. You're not going to be wanting to, even like they said, a gallon of milk. Like, you're not going to be wanting to do that. If you're somewhere where there's a lot of stairs, maybe you kind of try to get everything of yours into a space where you're not going to have to be climbing a lot of stairs, because that's not going to feel good for you to go up and down sets of stairs, not for a while. That's going to hurt. And I think you're even limited on when you can start driving. I think it's like a week or two before they're even going to let you drive. So you already know that motion that I'm talking about when you're pressing your pedals like this. It's going to hurt. It's going to feel uncomfortable. You're not going to like that. So again, everyone's different. There's some women who probably go right back to it. However, I was not one of those people who was able to drive right away. I was not one of those people who was going to be taking the stairs. I was the woman who, like I just told you, was swollen like out to here and had on my husband's underwear and wasn't doing any cooking or anything like that. So I definitely took the time needed to heal and let my body get restored. I'm not somebody who loves pain pills. So that was one thing. I think I was on those for at least a full week, and started to alternate, and you have to kind of keep track of everything. They come in handy. They definitely do. My doctor just had me on like prescription strength Tylenol and ibuprofen though. So it was like 500 milligrams, nothing crazy. So I wasn't on anything like that was super addicting. Not that all of these could, I guess, in a sense, be addicting. So I'm not trying to say that, but however, they just had me alternating the two of them. I know there's more powerful stuff out there. So that was good. And when I did start to feel better, that was the first thing that I wanted to do, was to come off of those things. One, they make me nauseous. Two, it's just, I don't like the way they make me feel. So once the pain started to subside a little bit, then I weaned myself off it little by little by little by little. I couldn't wait to get off of it. We already know though that pain pills and surgery and everything else is going to cause constipation. And so that was a scary thing, is when am I going to have to take my first bowel movement? Because you're already thinking, I am miserable, I'm in pain. It takes everything for me to walk down the hallway to go pee, and now you're going to expect me to have a bowel movement. And I know like some hospitals will maybe even keep you there until you have bowel movement. If you're anything like me, it's like you would have been waiting. They would have me there for a month, okay? You can't make me go on my best day. So I'm like, no, that's not gonna happen. It didn't happen probably for like seriously almost a week and a half after like I had my surgery, because of all the medications and everything. But I have a weird tummy, so I'm kind of like the oddball there. But the one thing that they do have you start doing is taking like a laxative of sorts. You're not going to want like a heavy duty laxative, especially after having a major surgery like a hysterectomy. The thing that they told me to take, which worked amazing, even though it was painful, I'm not going to lie, having my first bowel movement, was the Colace. Colace was wonderful. It was just, it's a stool softener. So it's not your normal like laxative that's just going to like make you sick with all the like intestinal cramping and everything. It's a stool softener, and that worked wonders. And so I would recommend that for any surgery that you have to have. Take the Colace. It's wonders. I mean, it works wonders. And so for me though, it was a lot for the first one, just because I was in so much pain, and so I have to put it out there. I have to be honest. If I'm not going to be honest, I might as well not even make these videos. But anyways, once you got through the first one, after that, I was good to go. So it's just like, hopefully you don't have that experience, but anyways, hopefully they've recommended that you take some Colace, because it will help. And so that is something I dealt with. And then another thing that I did end up getting after my hysterectomy was a UTI, which was not awesome. You're already kind of in the midst of everything, so don't be alarmed if you don't end up getting a UTI. They have a catheter in there. They have all different sorts of things that they're doing while they're in there. So I got an infection. I don't do well on antibiotics. I'm telling you right now. It's just like, yeah, I could probably do your normal amoxicillin, penicillin, but even then, that really is upsetting to my stomach and my GI tract. The medications that they have to use for UTIs is like real deal stuff. The sulfa drugs, my body doesn't like them. I get nauseous, I get dizzy, I literally get myself sick. So I wasn't really even able to stay on those for more than, I think it was like 5 days, and they wanted you to be on it for 10 days, and finally I had to call over to the doctor's office and tell them, I'm not going to be able to stay on this. I'm sorry, I'm just not going to. I mean, it was making everything like 1,000 times more worse for me. So I did it for 5 days. That was the best I could do, and it did end up, I think, taking away most of the infection, I hope. I mean, I ended up getting better, so that was a good thing, but don't be shocked if you don't end up with a UTI. So maybe that's something you already talked to your doctor ahead of time if you're somebody who's more prone, like kind of prone to getting yeast infections, UTIs. Discuss that with them, like, hey, maybe we need to have something called in. Is it okay if I have something on hand? Because that might be something that you may experience. So just another little like tidbit. Also, something that I never experienced before in my life prior to having my hysterectomy is back issues. I started to have back problems after my hysterectomy. So there had to be some type of a correlation there. And, you know, my doctor and physical therapist and everybody over the years have said that it's probably, you know, because of the core and where your uterus is and, you know, your ovaries and everything. It's just like you lose some strength in there after you have had a hysterectomy. You probably because you're babying it and because you've taken out, you know, organs and things like that. Your body is going to struggle in that area. So my core was not as strong after my hysterectomy, for one, but also I believe something probably happened in the midst of that, because right out of the gate I started having back issues. So when I say back issues, I mean tingling in my toes, blueness in my feet, bruising in my back. Like I actually had like something had happened, like I ended up with some type of a back issue. And I did have a nurse tell me that it could have been from the positioning of the surgery, because they kind of hang you for a long period of time. It's like 2.5 hours in a certain position. And so potentially maybe the way I was hanging or something, it pulled something. But afterwards I did start to struggle, and I still do have back issues, you know, ever since. So my core is stronger, so my back does not go out near as much, and I built strength, and obviously in time, 10 years, you know, my back has healed. But I struggled with that for several years after my hysterectomy, even like getting in and out of a car, sitting for long periods of time, sitting in metal places, sitting on wooden chairs, you know, standing this and that. Standing's always better because it kind of relieves some of that pressure. But that was something that I kept trying to talk to my doctor about, like many times afterwards, like, you know, I'm struggling from back issues now. And so that was going on. However, that has been a side effect for me. So maybe if you don't end up with a back injury after, you know, you have your hysterectomy, which I think is likely, and like you're probably not going to have that, very highly unlikely. Still, it will be a good idea for you to keep your core strong. So, you know, to maybe once you're able to, you know, a few months out, get back into just doing some light cardio, walking, you know, whatever it is that you feel like you can do, and keep that like nice and strong, because that will definitely weaken. And I'm trying to think if there's anything else that you absolutely need to know about your hysterectomy. Don't be surprised if maybe you don't lose a little bit of hair. Again, your hormones are changing, and you have obviously had a major surgery, and sometimes anesthesia can do that to you. So losing some hair is not completely uncommon. And just, you know, tell your husband to be patient with you, because you're going through a lot. You're going through a lot emotionally, physically, mentally. A part of you was just taken, a big part. And especially if you're somebody who was never able to have children, my heart goes out to you. I did have a miracle baby, I call him, because I was able to have one child, even though I spotted like through several months of that pregnancy. He is healthy and whole, and he is 14 years old. However, I did have a couple miscarriages as well. So I know how that feels, and I'm very sorry for that. But just, yes, ask our husbands and our children to be patient with us, and hopefully you have lots of care. Hopefully you have a good mom or sisters or friends that will be able to come over and help and assist, especially if you have young ones. You're really going to need the help, and you're really going to need the support. So anyways, hopefully some of these little things helped. And if you have any questions for me, just leave a remark. Thank you. Bye.